We are all smiles about our Positively Jax event coming up in April. We are partnering with the Florida Dental Association, and the result is you get free dental care. This morning, we're focusing on a common tooth problem that you might have a lot. It's called sensitivity. So let's talk about ways to prevent it. Dr. Roger Robinson Jr. with Northeast Florida Periodontics and Dental Implants here on the morning show. Good to have you here. Sometimes it's a hot drink, sometimes it's a cold drink, and you just get this sensation in your teeth, and it's unbearable. What causes the problem?
Well, very often it can be associated with several things. It can be associated with some root recession that exposes the root. It can be due to a crack in the tooth possibly, or an old filling starting to kind of give way. So those are things that you need to kind of take into account. And sometimes it could be due to maybe clenching at night.
Now, I know there's some over-the-counter toothpaste and things that claim to help you deal with the sensitivity. What is the best and most effective way to counter the effects?
Well, there are some technologies that are coming out, and there are new tooth desensitizers. You have products out there now like Sensodyne, not to quote any products in particular, but there's several that you can use. You brush with them nightly, and they'll start to build up a protection on the root surface. And a lot of them are potassium-based, potassium nitrate to be exact. And that helps slow down the process of sensitivity.
Kind of numb it?
Well, it doesn't really numb the tooth. What it does is it stops that interchange between the nerve inside the tooth and the environment in the mouth.
So it's stopping the communication.
Correct. So hot, cold, acidic foods, sugary foods, it slows that process down.
Bigger problem in adults than children?
More so in adults because of the aging process, accumulation of insults. Sometimes incorrect brushing can lead to recession. Again, as we age, sometimes you get little cracks on the teeth. These are things that can become problematic if not dealt with by a dental professional. So when you do have tooth sensitivity, it starts to become more prolonged or the pain becomes deeper, you really should see a dental professional for care.
Okay, you've cited a couple of different things, a crack in a tooth, maybe the root's not what it should be, or maybe your gums have receded somewhat. Are there preventative measures we can take before we get to the problem?
Sure. Seeing a dental professional again, for your annual checkup to make sure you're not experiencing gum disease, you're not experiencing decay, you're not having issues that could stimulate tooth sensitivity, absolutely. So
we have some pictures to show that basically illustrate the problem. Caitlin, what are we going to see here? Okay.
Perfect example of decay at the gum line. You get some recession. This is really cervical decay due to soft drinks and poor oral habits as well as nutritional habits. And so again, this is an example of a cracked tooth. So this tooth has a root canal, so you don't have the normal nerve translation or sense of pain, but the tooth did crack, and you can see down below at the end of the root where the damage is done, and the patient's starting to feel sensitive around that area.
So to draw an analogy, it's like if you have an open window and it's cold outside, the cold air comes in.
Absolutely.
Same thing happens with a cracked tooth. It allows the sensitivity.
Sure. So air in your mouth, yeah. Absolutely, and things like that. And this is another indication of where this is more the patient's tooth development. We ended up with a area of lack of enamel. And so, again, you've got that cervical decay that's occurring at those areas.
Is some of this inherited as opposed to
actually, because it is genetic, yeah, it is. And here's a picture of a papilla, a little area between the two front teeth there that's pink and red. And basically what's happened there, the patient started developing sensitivity. She couldn't tell if it was in the gums or in the tooth. So, of course, she saw her dental professional who identified the fact that, she had a little abscess forming here, and it was dealt with. So,
and I assume the sooner the better in getting to the problem?
Always sooner the better. Because if you let this go on, then what happens, you end up, in such as this case, with tremendous amount of root recession due to aggressive tooth brushing. And again, if you're not brushing correctly, using abrasive toothpaste, this can lead to that problem.
Dr. Robinson, thanks. Some good advice there. Help save some people some pain. Hey, if you missed any of this, you can revisit the interview on the morning show page of news4jax.com after about 10:30, 11 o'clock this morning. You'll also find information on News4Jax about that upcoming free dental event, April 22nd and 23rd at the Prime Osborne.